Hi, Four Points Forum. Brandon with Guild Mortgage here, and I'm here with Mike with Tillman Physical Therapy.
Correct.
Got it right?
Yeah.
I don't want to confuse them because you may have also seen our interview with David Tillman of Tillman Physical Training, and they're brothers. And this is the physical therapy side of their business. And so, Mike, tell us a little bit about your business.
Well, we've been doing it. I think we're coming up on 18 years now that we've been doing it, and you learn a lot. You learn about habits and you learn patterns. You know, we see the same injuries and in 5'4" and below and 6 feet and over because they fall outside of the norm.
Mm-hmm.
And so you look at patterns, and we enjoy fixing people, and we try to make them independent.
Mm-hmm.
We love to prevent surgeries naturally when we can,
Mm-hmm.
and I think there's a high percentage of that as well.
Okay, got it. Well, I do not know too much about the physical therapy business, and I didn't get a chance to talk to you too much before we met and get some details. So, tell me a little about what's the most common type of injury or I don't know, methodology that you do in physical therapy.
Well, we specialize in the McKinsey method, and it initially started as a back and neck specialization, but now has gone into extremities, and it's very specific. I'm not looking for 10 exercises to give you. I'm looking for the best one, so there's a lot of testing involved. But when we find the best exercise, we just get there quicker.
Mm-hmm.
You see patterns again. High frequency, is it a good direction, is it the right exercise, and are they progressing force? And that we have found gets people better faster.
Mm-hmm.
They're more compliant with one exercise than 10.
Mm-hmm.
And a lot of education. We have to not only get them pain-free, but we have to fix their posture or find out where it came from. And that's probably a big mistake that people make, is they get surgery and think that they fix everything,
Mm-hmm.
but then they go back to this same living, and so
Mm-hmm.
it comes back, and then
Mm-hmm.
after 2 or 3 surgeries, then I finally get to them, and I'm like, hey, you gotta fix the way you sit, or
Mm-hmm.
you don't fit in the average chair because you're outside the norm.
Yeah.
So if we don't address those things, then it beats people up over time. It's pressure over time wins every
Mhm.
time.
Yeah, that makes sense. I hear what you're saying, because it was my son broke his finger recently and had a bone all goofy in his finger, and the physical therapist there's just one activity to get it back. And the biggest concern was, of course, getting his motion all the way back.
Correct.
In the finger.
And that's a good point right there. I mean, anytime a joint loses motion, it hurts, and so I would say, a lot of these total knees that we see that are done, a lot of them don't need to be done if we can get the motion back. And the
Mm-hmm.
reason their knee hurts is not necessarily because they're bone on bone, it's because they lost the ability to extend the knee, which means they can't tighten the quad.
Mm-hmm.
And so we love to see them first, because if we can get them pain-free, then they're going to have a very good functional life.
Mm-hmm.
And not need a surgery, and or even push it off longer.
Mm-hmm.
It's really a plus for the patient.
So something that I just heard, correct me if I'm wrong, and something I might be learning is, if you've got that pain, particularly in joints or back, before going to the MD and getting any sort of prescription or even look at surgery, come to a physical therapist and see if it's a motion or a lifestyle choice that needs to be addressed.
Correct. Well, the way it works in Texas is one of 3 remaining states that you have to get a script before you come and see us, so you do have to see the doctor.
Okay.
Which is okay, but what we like and what we try to educate the doctors on is, come see us first. We're the cheapest, and I think we're very effective. MRI's $2 to $3 grand, and that's at least 15-20 visits with us. And if we can get you better, people don't understand that there's things wrong at a certain age. If I MRI, how old are you?
37.
So I would say 30% of 37-year-olds have herniations, and so we assume that, and so if you're 60 with knee pain, I'm assuming you have some bone on bone. And what I want to know is if I can get it better, because if I do, then all that doesn't matter. If I get you pain-free and get your motion, then you don't need a surgery. So we like to save people all the money they spend on these tests and see if we can just get them better conservatively, rather than just jumping into surgery or MRI, those kind of things.
I like it. Tell me a little about yourself, what you did before getting into this business, or how you got here.
Yeah, well, I was always in athletics, and I was a trainer. I too got CrossFit certified, so I know a lot about exercise. So I'm very picky when it comes to exercise, and I can assess. And I've developed into understanding how outside exercise affects exercise. In other words, your posture,
Mhm.
you know, and the bad habits that we get learn to affect you. And I love that. I love finding that habit. It's typically easy for me to make pain go away. It's hard
Mhm.
for me to keep it away if I miss a habit. And so
Mhm.
the patient is an important part in that. So you have to ask the right questions. If you don't have any pain at noon, but you start hurting at 5, what
Yeah.
were you doing?
Yeah.
Where were you? And you're looking for those kind of patterns to help them think about their pain and solve it as well.
Awesome. Well, I appreciate it. Thanks so much for meeting with me
Yeah, I
and doing
appreciate
the
it.
interview, Mike. Appreciate it, and hope you have a great day.
Yeah, thank you, sir.
Thanks so
Appreciate it.
much, 4 Points 4, and we'll see you next time.
Thank you.